welcome back to Synapses. My name is Kevin and I am a final year medical student in Malaysia. On 3rd of August 2020, I am officially going back to clinical school in Seremban. For those who are not from Malaysia, our country is having a lockdown because of COVID-19 and we call it as MCO. And because now the case is getting lesser, so we are able to resume our clinical studies. Before the MCO, I was halfway through my pediatric posting and now I will be continue my pediatric posting in Seremban. This means that I get to experience two different kinds of clinical setting, which is before and after COVID-19 infection in hospital. When I first heard that we need to go back, I was so shocked because the news is sudden. We were just having a town hall meeting with my university and they told us to go back in the next week. During the MCO, I feel like I don't know what to do, but now I can think of a lot of stuff to do. But anyway, I am glad that we are able to resume our clinical studies so soon because God knows when we are able to graduate. My medical course is 5 years in total. And I do feel happy going back to pediatric posting because I love pediatric and I love to play with kids, so I am fine with that. Before we go to the hospital, we were having a detailed briefing about what to do in hospital. We are assigned to 3 different kind of hospital. Hospital Tunku Jafar, which is in Seremban, Hospital Port Dickson, and Hospital Kuala Pilah. We are limited to 5 students per ward and 1 student for 1 patient. Obviously, you need to wear a surgical mask when you approach the patient, and if it's a respiratory case, you need to wear a face shield. Hand hygiene is very important, which is routinely done even before MCO. We also need to sign in with apps called MySejahtera so that they can keep track how many numbers of human in one building. We don't want a crowd. COVID-19 definitely affects our clinical experience. First, our clinical exposure is lesser. You see less patient, less interaction with the patient, and you definitely has lesser opportunity to see any physical signs on the particular patient. It is more difficult to discuss the case with your lecturer because last time we discussed the case in the ward, so we can go back to the patient if we see any interesting findings. But now, after we have clocked the patient, we usually discussed in the classroom, so we don't get to go back to the patient. And because of 5 students per ward rule, we have our own schedule to go to hospital. We cannot go anytime we want. And because of that, we cannot go earlier to clock a complicated case. We don't spend a lot of time with the patient because usually we only assign 4 hours maximum. You are no longer be able to do on-call, which most students don't do. You also see lesser patient because they don't admit the patient unless they are really necessary to go into the hospital. And because of that, you have less case variety, so perhaps you only see asthma in the whole day. Another thing is that I am in pediatric posting, so I deal with kids, and I feel that face mask is definitely a barrier to build a rapport with the kids, especially for kids who are around 6 months. They start having stranger anxiety, so it's really hard. They are already scared of you. With a face mask, they're even scared of you. You need to find a way to interest them. But a good thing is that the approach to reduce infection is excellent. You don't touch here, touch there. You should do anything to reduce the risk of infection transmission from one patient to another. On my first day, I was assigned to Hospital Kuala Pilar, and Hospital Kuala Pilar is 45 minutes to 1 hour away from the place we lived in. We need to reach there by 9 because we have our case discussion at 11 o'clock. It was quite cool going back to hospital, and on my first day the case is not that much. It's roughly 6 to 7 patients in the whole ward, and my case was acute tonsillopharyngitis, and it's quite straightforward and simple case considered, but it's cool. I get to play with kids, so yeah. Overall, the first day is cool, is good, and I feel that definitely that's a difference between pre-COVID-19 and now. But we try our best to learn in this very moment, and I feel that we can overcome this, and this is a great experience overall. And here is some footage of my first day.